Mohammad Afzal, our Executive Director NIH, Major General Dr. Ikram, all my colleagues from WHO, and all the distinguished participants from NDMA and NIH, colleagues and friends, ladies and gentlemen. I am deeply honored and humbled to be here standing before you in this wonderful morning to make another donation from World Health Organization to NDMA and subsequently to the people of this country through NIH to make a robust and quality comprehensive response to COVID-19. Since the infection began here, we were working very hard with our colleagues, hand in hand with the government of Pakistan and NDMA and NIH and health authorities, federal and provincial, to see how best we can support for a comprehensive response for COVID-19. And since the first day, we were working very, very closely with the health authorities to ensure that point of entry screening is done perfectly and the rest of the response is maintained as we intend. And also, we have collaborated very closely with NIH. Since I came here for last 1 year, we have met so many times and working very hard, very closely with NIH, particularly the leadership of Professor Ikram is so very much in this COVID response. And I have to tell the World Health Organization always supporting the government. The government is under the leadership of Honorable Prime Minister and His Excellency the President, moving very fast and hard on the ground to make sure that all the response make as intended. There's a plan came out now jointly led by NDMA and supported by the Ministry of Health as the strategic preparedness and response plan, which will be launched hopefully next Thursday to get more support from the international community. I don't think this is a time that I should speak in length, but I am very much impressed and happy how the chairman of NDMA is under his guidance, the management team of NDMA is moving on the ground to ensure that the response is quality, comprehensive and robust. And also I should mention, though our health minister is not here, he is a public health specialist and giving his leadership as well for this in the most accepted way. And he is taking all decisions on epidemiological data and science, and that's very impressive.
We always consider NIH as part of WHO and WHO as part of NIH. As you all know, whatever has been done practically on ground is a teamwork. And I always say if we win, we will win collectively. And unfortunately, if we lose collectively. So it's a team effort that sails us through. And that's the motive behind, that's what we have been working for. We are extremely grateful to WHO for providing all the assistance in this regard, and it's not confined to such equipment, it's much beyond that. I'm extremely grateful to the leadership of Dr. Pelletha, who has always been there, just one call away, and we have been working in a very close collaborative manner. As far as NDMA is concerned, we are working under the umbrella of NDMA, and at the time NDMA took over this challenge, the things transformed in tremendous speed, and the way the things were, not only it's the procurement, but I think it's more so related to the exact precise utility of the item. That's also something very important, because procurement is just one aspect. And we have already devised a plan for replacement of these equipment, and we'll start with the Shafa, and then we'll discuss with the other team management as well. And that's how we're going to utilize them. And rest be assured that we will make maximum use of these, and not only for COVID, for years to come, for other ailments as well.
Most of the things are on the dot. Once I say it's on the dot, we have been able to take control of all our borders, both rather all three, the ground, sea and air borders. We have made arrangements to control the inflow of traffic. We have made the arrangements of outflow of traffic. Although the borders are always controlled, but these are never controlled from disease point of view. These are never controlled from health point of view. So we have taken control of borders from that point of view. The second is that we had a lot of difficulty in finding out right kind of personal protective equipment. Few of the pieces were imported from China, and in initial days between 13th of March and about 27th, 28th of March, we were in a deep trouble. Alhamdulillah, Pakistani nation has woken up, and at the moment, except N95, we are not importing any single piece of personal protective equipment. All we are buying from the local market, and it is, and let me tell you, there's no dearth of these personal protective equipment. And let me also talk about quality of it. We have clothing which is of GSM 80, which is as comparable to any of the company which is in the world. We have GSM 70 and we have GSM 60, and there are a number of others, but we are not buying those. So let me tell you that as far as protective equipment is concerned, we are good. We have already provided 3,900 pieces once to all frontline doctors. Yesterday we have completed the second round, where we have provided frontline doctors, nurses, and even those working in hospital, whatever they needed in 502 hospitals of complete Pakistan through Pakistan Army. And today most of them would find it with them. I know in Punjab and part of Balochistan and even Gilgit-Baltistan, it is already with the doctors. Let me also tell you that we are now ready to supply over 100,000 PPEs to all hospitals every week. And if required, we will be able to supply more. And as far as testing is concerned, let me tell you that on 14th of March, we had 14 laboratories. And we were testing around 800 or so. And today in the National Command and Operation Conference, I'm going to raise this point that now instead of people who are showing sign for the disease, we should not be testing them alone. At least we should start testing those localities which we are trying to put under lockdown. And we should take out people who are not affected by it so that they can lead the normal life. Let me also tell you that I am also thinking to suggest it to the provincial government that they should at least go for the carpet testing for those localities which they fear that it can have an outbreak. I can provide them the capability, because at the moment we have 39 laboratories functioning. We are working on 27 laboratories to come up in 1 week's time. 11 out of them are from military. Hopefully we will be able to do it by next Monday. If not 25, at least we are planning to have half in the line. I would also share with you that today in my warehouse there are 600,000 samples of testing which are sitting in our warehouse. If I include these 7 machines, we have 14 extra machines now would be going in the warehouse, and we would be distributing among those 25 which I had just talked about. Let me also tell you that we are harnessing our capabilities which are there in the country. For instance, I am getting data on TB laboratories, and hopefully we can do a lot of things with them. But the major breakthrough which we had, there are almost more than 100 mobile laboratories which, if equipped, could be sent to those localities which we fear that there is an outbreak in them, and we can test those people, and those who are not affected, at least we can take them out, or those who are affected, we can take them to the quarantine center if we don't want to keep them in the localities. We can take the measures like disinfection of those areas too. Lastly, I had already requested the Dr. Mahapala regarding ventilators. What we have already planned is, we had planned was to have more than 2,500 ventilators by end of April. That might not happen, but we have carried out a kind of improvisation by dedicating almost 40% of ventilator, which makes around 1348 ventilators purely for COVID. And we have also chalked out a plan that if the pressure increases more, we can have another 400 from Punjab to be converted into COVID. And finally, we will have around 800 to 1,000 ventilator, including non-invasive, which we will be utilizing for the normal patient and those patients who could be sustained by the non-invasive ventilators, and those ventilators could be shifted to the COVID patients. So as far as our planning goes, we can sustain 2,500 to 3,000 patients even without the major induction of new ventilators in the country. But as I told you, we are banking on till 25th around 1,000 and maybe 1,000 in May, and hopefully the way we are trying to take things, the curve will be gradual and we'll be able to face the entire thing smoothly. Once again, in my personal capacity, I would like to thank Dr. Palita Mahapala, also the management of WHO for always standing by us in every crisis. I remember WHO coming in big way once we were working in 2005 in earthquake, and in 2010 floods. I was there and I saw each one of you there. Thank you very much again for standing by us.